Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to all. My name is Nursyafiq bin Shibramulisi and I will be representing my group, this group 2 set 2, and my team members are Qays, Tayseer, Mohammed, Al-Horani, Anizah binti Mahmod, Zainorain, Natasha binti Zainal, Arifen, Amina, Asif, Siti and Revathi, Kathir, Chelvam. And our facilitator is Dr. Siti Shahara Zulfakar. Our research title is about the awareness and confidence among COVID-19 vaccines among selected students in Faculty of Health Sciences, and it is a comparison study among Malaysia, Pakistan and UAE. This is our outline for today. And for introduction, COVID-19 pandemic is a global healthcare emergency, and since its first case in Wuhan, the new coronavirus has spread globally and affecting countries around the world. The outbreak was announced in January 2020, and March 2020 was been declared as a pandemic. And this pandemic has impacted the world in an unpredictable way and affecting billions regardless of privilege and wealth. Okay, so for our review, it is found that India, they reported that medical students in India, they felt that healthcare students and professionals must mandatorily receive the vaccines. And also in Jeddah, Saudi Arabia, it showed that majority of the students were aware about the risk of COVID-19. And then in Jordan, it is reported that poor acceptance of COVID-19 among public, and since they emphasized that public trusted information from healthcare providers must be made. Okay. And also Godly reported that the government health departments must ensure that good information is released for public consumption to ensure the trust towards COVID-19 vaccines. So this is background of our study. So the second wave of COVID-19 has hit Asia badly and caused countries to declare state of emergency. And also in Malaysia, the government has employed several measures like the MCO and also stringent screening process at all sectors of economy. And similar efforts has been observed in other countries such as UAE and also Pakistan. This is our research justification. So this study will focus on 3 Asian countries to determine the awareness and also confidence about the COVID-19 vaccines. And so since COVID-19 is also a major threat to Asian countries, and the researchers are natively from these 3 countries, and we want to compare the awareness and confidence in selected students in Malaysia, UAE and Pakistan about COVID-19 vaccine. And this study will be one of the few multi-regional studies conducted to assess the awareness and confidence of COVID-19 vaccine among selected undergraduate university students. So as we can see here, the statistic, we found that until June 2021, UAE has the highest percentage of population being vaccinated, followed by Malaysia and also Pakistan. Okay, this is our conceptual framework. As we can see here, we will be studying about understanding of risks and benefits, which will contribute to the confidence in getting COVID-19 vaccines. Okay, so this is our research question. What is the awareness and also the confidence in getting the COVID-19 vaccines among the 3 countries? And this is our research hypothesis. We hypothesize that the awareness and also their confidence in getting the vaccine is good. Okay, this is our objective. The main objective is to determine the level of awareness among the students in Faculty of Health Sciences in 3 countries and their confidence in getting the vaccine getting the vaccines. And our specific objectives is to compare the awareness and then to compare the confidence and then to determine the association between awareness and also the confidence. Okay, this is our methodology. Our research design is quantitative study and is also a cross-sectional study. So we use a Stukov questionnaire as our research, which adapted from study by Nian Kara and also Luigi. We also tested it for validity and reliability. It has 3 domains: social demographic data, awareness and also confidence. So we managed to recruit 405 undergraduate students in Faculty of Health Sciences in 3 universities, as stated there, and used convenience and snowball sampling method. So for data analysis, for awareness and confidence, we will describe it as a descriptive analysis. And then for statistical analysis, for objective 1, objective 2, we were using ANOVA. And for the association between the variables, we were using correlation. So we used SPSS version 27.0 for the data analysis. So this is our result and discussion. For the pretest result of Stukov questionnaire, we use content validation and also face validation. Okay, so the score value all is acceptable, and also we managed to do the reliability test where we recruited 30 students for each country to do the pilot study to check on the reliability of Stukov questionnaire. So this is the Cronbach alpha value. Okay, for the social demographic profile, so if you can see here the respondents from the 3 countries and also according to the year of study. So the mean age is 21 years old. Okay, so majority of the respondents is from the nursing course, and then the source information, most of them got their information about COVID-19 vaccines from social media, followed by the internet. Okay, this is regarding the benefit of COVID-19 vaccines. Here we can see most of the respondents agreed that vaccination aims to provide protection against COVID-19, and COVID-19 vaccination is a safer way to help building population immunity or herd immunity, and COVID-19 vaccines will play an important role to help control the pandemic. Okay, they also agreed that the vaccination program is effective in developing immunity against COVID-19 infection. Okay, you can see here also COVID-19 vaccines can reduce the mortality rate. Okay, regarding the risk, almost all the participants agreed that vaccines has common side effect. Okay, and then you can see here they also agreed that the vaccines has been subject to adequate testing and go through several stages of preclinical before they approved for use. And you can see here, so people who receive COVID-19 vaccination should continue to follow and adhere to the preventive measures. So they also agreed on that. Okay, so for objective 1, to compare the awareness regarding the COVID-19 vaccination. So we can see here we found that there are no statistically significant differences on the awareness between the students in the 3 countries. Okay, so related to other studies that Hamzah reported that they found in their systematic review that the average age of health information seeker were ranging from 18 to 29, and they were using internet as the most used medium in searching for health information. Also, Nazir in 2020 reported that social networking sites had been great in disseminating information regarding the prevention of COVID-19 vaccine, thus increasing public awareness and knowledge related to COVID-19. However, Friedman reported the opposite, where slightly more or less than quarter of the respondents aged less than 25 years old were getting their information through Facebook and Twitter. Okay. So in our present study also, we found that most of the respondents getting their information from authorized organization. So Friedman also reported the same, where the respondents from who age less than 25 years old, they get their information from CDC, Local Health Department, and also WHO. But this is lower from our current finding. Okay. Regarding the vaccination status, this is the one we can see here that most of the respondents from the UAE already have completed their 2 doses of vaccination. Okay, this is relatable to the data that we found in our work in data. So the people who receive at least 1 dose on COVID-19 vaccine, so the highest percentage is from UAE compared to Malaysia and also Pakistan. And also the population that get the fully vaccination. So you can see here also UAE has the highest percentage compared to Malaysia and Pakistan. Okay, so regarding the confidence, we can see here most of the respondents also agreed that the vaccines is available in their country, okay, and that they trust healthcare sector in providing the information regarding the vaccine, and they also agreed that the vaccines are safe. Okay, for objective 2, we want to compare the confidence in the usage of COVID-19 vaccines against the COVID-19 infection. So we also found that there are no statistically significant differences between the countries. Okay, so our present study, we found that confidence in healthcare sector is high. So it is opposed. It is not in same like what reported by Imperial College of London, where they report the confidence of healthcare sectors varies from 70% up, from 42% up to 70%. Okay, for objective 3, to determine the association between awareness and also the confidence. So the association between the awareness and also the confidence, we found using the correlation that we found that there is a statistically significant and weak association between the awareness and also the confidence. Okay. So in present study, so we found the association. So Horani et al. Has also reported in their systematic review that there was an association between health literacy and vaccination status. So as a conclusion, it is noted that respondents from Malaysia were having more awareness regarding the risk and benefit of COVID-19 vaccines, followed by UAE and also Pakistan, but the differences is not significant. Also, the confidence, it is found that respondents from Malaysia were having more confidence in taking the vaccines, followed by UAE and lastly Pakistan, but also there is no significant differences between the three countries. Okay, then also a weak association was found between awareness and confidence in getting COVID-19 vaccines. Okay, this is the strength of our study. It's one of the few studies that comparing between students in Faculty of Health Sciences in 3 countries. The Stukov questionnaire can be published and distributed as it's already been validated. The targeted population was students from Faculty of Health Sciences who are supposed to be well informed and should be the role model for the public. And number of respondents were greater than the calculated or needed. And results from this study can be published as it involves international respondents. So this is limitation. These are the limitation for our study. So this study could not determine the cause and effect relationship, and the study only measured the sample's awareness and confidence at one period of time. And because it is a cross-sectional study, and the study doesn't represent the general population due convenience sampling technique, and this was due to the short period of time given to conduct the study. Okay, so for future recommendation, we recommend that this study could be repeated by including more countries with longer period of time, and a randomized sampling method also can be used to represent the real population. Other than that, more participants can be recruited for future study, and a thematic analysis can be done using qualitative approach for this study in the future. Okay, so this is our references. Thank you.